When a couple goes without intimacy for too long, some women can become irritable and emotionally volatile. 100 years ago, this kind of emotional turbulence had a name: hysteria. Dr. Dalrymple ran a clinic dedicated to treating this condition. He had mastered a very specific technique, one that helped women release their built-up emotional tension with remarkable success. But Dr. Dalrymple was getting old. He could no longer handle the physical demands of the job, so he began searching for an assistant. His hiring criteria? Strong, nimble fingers. Enter Mortimer, a young man eager to help. Dr. Dalrymple personally trained him, teaching him every detail of the technique. Mortimer took meticulous notes and quickly got the hang of it. Before long, it was time for his first solo session. The patient was hesitant at first. After all, it wasn't the doctor himself. But fortunately, Mortimer was handsome enough, so she agreed to give him a shot. Mortimer was clever. He didn't just copy the technique, he improved it. What used to take the doctor 20 minutes, Mortimer could accomplish in under 10. And the results? Even better. The patients were thrilled. Word spread fast. The line was longer than a Black Friday sale at Walmart. Appointments were booked 2 months out. Some patients even offered extra cash just to jump the line. But the constant, high-demand work took a toll on Mortimer's hands. His wrists ached and weakened. Still, he pushed through, doing rehab exercises daily. But the overwhelming patient load left him no time to truly heal. He kept his injury a secret. He couldn't afford to lose this high-paying job. Then one day, after finishing a session, he plunged his hands into ice water to soothe the pain. But before they could warm up again, another patient walked in. He rushed to begin treatment, forgetting to let his hands recover. The moment his ice-cold hands touched the patient, she instantly lost interest. The session dragged on and on. With his wrists giving out, his technique fell apart. After an hour of failed effort, the patient stormed out in frustration. Mortimer looked at the long line of women still waiting and finally admitted he couldn't keep going. He confessed everything to Dr. Dalrymple. But as soon as the doctor realized Mortimer's hands were no longer usable, he fired him on the spot. No hesitation. Depressed and defeated, Mortimer went to visit a friend. That's when something caught his eye. An electric massager. An idea sparked. What if he modified the rotating part into a rapid thrusting motion? Could it replicate the treatment without using his hands? He and his friend got to work, and just like that, the world's first electric device for female pleasure was born. To test it, they invited a professional sex worker. Their logic was simple. If it could impress her, they knew they had something special. And sure enough, she gave it glowing reviews. With the success of his invention, Mortimer patented the device and quickly became a wealthy man. He would never have to use his fingers to make a living again.